All right, Dr. Cruz, how's it going? Thanks for jumping on.
And it's going good. Thanks for having me here, Graydon.
Amazing. So, why don't we get started by if you could just really quickly introduce yourself, Dr. Cruz, and your business, your medical spa. Maybe just give us, the viewers, a bit of a background on your business to start.
Awesome. Yes, I am a physician, as you know. I have been owning our medical spa for about 6 years now, and we're located in Central Florida. It's a small town, like in the outskirts of Orlando, in the main Orlando area. And yes, we've been here for all that time now. And my
Hmm.
background is essentially in general surgery. I did a few years there, transitioned thereafter to doing more of the cosmetic aesthetics things and intertwined with some wound care as well. So here we are.
Cool. So it's a kind of a similar path to my dad, how he started off, and a lot of people
Mm,
have this similar path too. You're starting
right,
off in like hospitals, non-elected medical, and then you
right.
transition over. Did you do a full? What did the transition look like when you first opened up the clinic? Did you start off like very small, just a few hours, and slowly increase that?
Yes. Yes, that's how we started. Essentially, I was still on the wound care job and I still am doing the wound care job. I like it. It's a population in need and it's a service that we provide. And I have been able to intertwine both and handle the growth that we've been having with my clinic. I started working pretty much on one exam room one day of the week on the med spa. No database of clients whatsoever, just word of mouth. Some people that I knew. I did share premises with a primary care group, and that's pretty much where I started. I started renting out just one room and essentially an office for myself, and things started picking up thereafter. And we can probably get into more details in a
Yeah.
little while
No, that's cool that you
how that
still do some of
happened.
the wound care. I mean, some people like to get out of it completely, but yeah, like you mentioned, it's like it must be very rewarding to do
It
that type of work
is.
as well.
It is very much, and it's on elderly population. It's very rewarding. They are in need, and it's also something that I enjoy.
Probably does that because it also has to do with lasers. Because with your like, you're kinda wounding the skin with lasers, right? Does any of that transfer over, like, with the wound care to helping people heal better, faster after their
Yes,
lasers?
most definitely, because essentially what we're doing with our patients here in the aesthetic field is that we are creating an injury in the skin to actually tell it to heal itself, tell the body to heal itself. And at the same time, there's other topicals that we apply. It pretty much translates. Having that wound care background does help me understand the entire process of of wound healing, and that we can guide the patients on a more robust way on how
Mm,
to take care of the areas in the face or in the body, because we do other treatments in the body as well, and it actually translates.
well, let's talk a bit about the marketing. So, we've been working together for quite some time now, like, close to 3 years, I
Yes,
think,
yes, three
and
four years.
yeah, and before you were working with us, were you working with any other company, or were we the first company you started working with?
Actually was working with another company before you guys. And that's one of the things that made me a little hesitant on doing a change because I had a bad experience. I pretty much was burnt. I mean, things that were said, promised, and were not delivered, and then you become hesitant and you become
Yeah.
kind of you hold yourself. Let's put it that way. You hold yourself on making a decision on either investing more or doing a switch because you're thinking, well, I may get burnt again. But it was entirely different. I researched your company and then met with you and started working together to make the decision and started working together, and I have not looked back. I have
Yeah.
not looked back,
No, it's
honestly.
been,
And I don't
it's
expect to.
yeah,
I don't
it's been a
expect to
journey, like,
actually.
we've gone through so many changes in the business, and you've been with us this entire time. We have so many cool things coming up, so
Yes.
it's awesome that you've been with us the entire time.
Yeah, things that I look forward to as well as we have evolved ourselves and greatly in part to working together with Forever Booked. I know that you guys have evolved as well, and that's part of the whole process. Essentially, if where you're at right now, when I say that, I mean working with another marketing company or another group or however you want to frame it. If they don't evolve with you or evolve themselves, then there's a moment for change.
Yeah.
That's a flag for a change.
Mhm. When you were considering working with us, what were the problems at the time that you were looking to solve? What were the bottlenecks that you're looking to improve? If you can remember back that far.
I'm trying actually. I'm actually trying. I can pinpoint some. Essentially lead volume and lead quality in simple words and streamlining operations, streamlining the lead acquisition. I can use the terms now as I've learned so much throughout this whole process alongside with you guys. But that was the main thing at that point. And of course, we cannot hide it. We cannot be afraid to say it, increase our revenue because that's the bottom line. We're also in a business. We're doing some things to help the patients in different ways and such, but we're all in a business and we have money coming in and money as it comes in, it comes out, it goes out. So that was one of the other things too.
So you're looking to increase lead volume, lead quality, which is pretty much, yeah, everyone wants more leads, better quality leads. How did the other company that kind of burned you guys, how did they fail on that? And then how did our company help you with that better? Just getting more leads and better quality leads.
So with that other company, what happened was that essentially things were not moving in the right direction. There was a disconnect as far as the lead acquisition and the ways of resolving that and the volume of it. At that point in time, I would not have any access to any of the details of what was going on in the background. And that changed when I started working with you as far as obviously being totally upfront and honest of how the acquisition was going to happen. The offers, I know that that has evolved substantially ever since we started from day one. There has been evolution on that, on how to construct the actual offers for the market. And then you test, and if you have to pivot, you pivot, and that's what we have attained with Forever Book. It's a clear cut path on how to acquire the leads, how to pivot if you have to pivot in some way, shape, or form. You can do it yourself or they can do it along with you. And it's been pretty crystal clear, if that makes sense.
Yeah, let's talk about some of the campaigns. So obviously we've run a ton of campaigns together over the years.
Yes.
We've run
Yeah.
quite a few, and oftentimes, like, you're our sort of guinea pig with new stuff we wanna run, which is great. Do you have
Yes.
any, like, favorite sort of all-star campaigns over the years that you remember, like, "Oh, that was really good. This really helped." Anything
Yeah.
that comes to mind?
Yeah, I have plenty. I have plenty campaigns that we have run together that have been, I would like to say, the silver bullet of our business. And to name a few of them, IPL is one of them. Laser facial, photofacial talks, like neurotoxin campaigns. Those have always been a hit when we ran them, and skin tightening campaigns. Obviously, low ticket. Every market is different. In my market, that's what has been working for us, and we were able to bring in the leads. And then Foreverbook has given us a structure on how to make that flow when the patient comes in. Yes, you have them booked, but then you have to do the conversion in the clinic, and you have to explain the patient what the concerns that they may be having, and then how to take good before and afters, how to present those before and afters to the patient, and then how to convert them. And that's something that we've learned along the way with you guys.
Yeah, let's talk about that process because there's low ticket, we're using a unicorn offer structure. So
Correct.
we have so for example, the IPL will be like discounted IPL, and then you'd have like a bonus and then a consultation. And then once they come in, what's your flow for when they come in? Let's just walk through that entire process when they come in the clinic.
So essentially, they communicate with us once they sign up for the offer, as it's presented either on Facebook or Instagram. They sign up. We have a growth operator, an assistant that helps us track those patients and follow up with them and helps us book those appointments with a deposit or a card on file, because that's also another thing that I was having. Now that I remember, in the past we were having issues with no shows. People were booking and we didn't have them show up, and then it was a waste of our time and my staff's time in general. So that's another thing that we were able to fix with Forever Book's help. Obviously, those are booked appointments with a deposit or a card on file. They come into the clinic, they get greeted by my staff, my team, and at the same time, they undergo a full consultation. We have a presentation consultation that we, for the consultation that we do, show to them alongside with discussing all their medical history, their medications, because bottom line, these are medical procedures that we're doing on these patients. People think, oh, it's just an injection here and there, it's just that laser or whatever. But if we don't do things safely, then you can have complications, and we don't want to deal with any of that. Not saying that they cannot happen, but that's part of what of our strategy to prevent them. It's getting the full context of how we're going to help the patient. And of course, with that presentation, we had it as a framework from Forever Booked. It has evolved over the years. We have incorporated a lot of our before and afters, and as we have included all the devices in the practice, we have incorporated before and afters from those devices in there so that the patients can have a whole idea of what we can offer and how to implement combination therapy. So when I sit down with them, my team has gathered all that information. So I present to them the options of what we can help them with. Generally, we incorporate that unicorn offer that the patient came in with into a package, which Forever Booked has helped us
Wait, so when
develop
you
the
say you
packages.
sorry to cut you off. When you say you integrate it into the package, do you do the assessment and then the treatment and then the recommendation? What's the order of those 3 things?
So we do the assessment, we do the recommendations, we do the treatment, and then generally they have a follow-up appointment. And then on that follow-up, if they don't commit to the package when it's presented right then and there, we connect on the follow-up visit so that we can, okay, are you ready to do the package or are you
Okay.
not?
Yeah, that's smart, but you still give them an option to buy the package on the first visit?
Of
Like
course, of course.
mhm,
And what we do when they opt in for a package, depending on the package size, we normally collect a 25% deposit of the package, and that's their commitment to it. And something that has worked very well on our end is for the patients and for ourselves too, is that they don't have to pay the whole package up front. If they opt to, that's fine. But what I normally do is that I have them pay as they go. So generally a treatment can be every month. At some treatments, generally the lasers are, or for example, sticking with the IPL, and IPL is usually every month. So they can come in for their package of 3 IPLs and they can pay as they go and split in 3. So that makes it easier for them as far as finances go.
okay. And then with the follow-up, what's your expectation setting for that? Do you set the expectation that everyone does a follow-up and it's just what you do?
Yeah, that's what we do. Everybody gets a follow-up. Some people opt not to do the follow-up, but we still, if they say, "Oh, I'm not gonna make it," or "I don't think I need a follow-up," or whatever, we
Mhm.
still, as a team, reach out to them and see how they are, how was everything after their service, and bring up the fact that we had recommendations for them to continue their transformation and to achieve optimal results, and gather their thoughts on moving forward or not with that
Yeah, I think
recommendation.
that's a really good thing to do. A lot of clinics, they're not going to set the expectation that we do a follow-up and it's more like an optional thing, or it's almost like it's like a downsell. They're trying to get someone to do it. But if you just make it part of your process, like, look, if you
Yeah,
frame it more as a medical thing, this is a medical
yeah.
procedure and medical procedures require follow-ups, it makes a lot more sense. You're gonna get a much higher take rate for that.
Yeah, and also with another of the unicorn offers that we discussed, like the neurotoxin, for example, what I usually tell the patients, we have a follow-up, and that's in 3 weeks generally for a specific reason, and one only is that if you need a touch-up, that's free for you. And then if it's a free touch-up and then they need corrections that need to be made, they can come in 3 weeks and get those corrections done. And that's the best segue for us to actually introduce the actual package recommendations that we had brought up on consultation to see if they're going to move forward or not. If they had said, I'll have to think about it, talk to my spouse, or check finances, any of the things that people sometimes say.
No, that's great. And then I'm curious for your packages. What are your top packages that you sell, like the most popular ones, and what do they include?
Wow. For the IPL, one of the most popular ones is the 3 sessions of the IPL with neurotoxin altogether and some
Mhm.
bonuses included in there. That's one of the top sellers. The other one's the only 3 IPLs with a bonus. That's a big seller. Now that we have the Morpheus device, there's packages that we've constructed now that I learned the framework on how to build packages from what I've learned over the years with Forever Booked, we build the packages depending on the services that we have. And now that we incorporated in a year or two ago the skin tightening procedures, I've built out packages that include that and combine the neurotoxin and some fillers in there. And those have become very impactful, to be quite honest, in the
Nice.
past few weeks.
Sweet. Are you using the tailored treatment plan to build them? Because with packages, it's nice to start with a template and then
Mhm.
customize it. How are you doing that? Are you just having like set 3 tier type packages, or do you have a template, then you customize it with the clinic, with the patient?
I'm essentially building it out with the three-tier system, the framework that Forever Book has provided us. That's the
Like the
framework
good,
that I've
better,
been
best?
using. Correct. The good, better, best, essentially. Granted, I have that as a framework in clinic, and we have them printed out strategically throughout the flow of the office. But at the same time, if a patient has a different need from what it's in the package, it's not how can I say this? It's not set in stone that those are the components of the package.
Yeah.
I customize it based on the patient's need, and I take things out and I insert what the patient needs, and then I try to work with them as far as the pricing point goes and try to find what will be an option for them that matches kind of the pricing. And if we have to upcharge, then I explain to them that that's an added upcharge and stuff like that.
No, that's the way to do it, is to start with the template and then just be able to customize it.
Correct.
Let's talk about events, because that's another thing you've recently started, right? Events
Yes.
not just for existing clients, but wait, have you been running ads to them as well, or just been advertising to your existing clients?
Both. We've been doing
Mhm.
both at this point. We started the event approach honestly about 2 years ago. I learned a lot of what I know for events through InMode, which is the company that we bought the devices from. Obviously, as we've been growing with Forever Books' help, we've been able to incorporate more devices in the clinic. And then 2 years ago, I got the Ignite RF platform that includes Morpheus and then the skin tightening devices for post GLP-1 weight losses and aging in general. So we started doing in-person events with their help. They would be helping us to host those. And we started targeting then our established client database. That included patients of ours and people that had some interest at some point with any of our services through one of the systems that Forever Booked has, which is the booster shot. With that, we started targeting the whole database, and now we have evolved into doing, I would say, a twice a year in-person event. We rolled out earlier in this year a micro event of a smaller group of people. We did that one with advertisement, and we had great ROI from it. And that was the other system that we incorporated in the practice along with Forever Booked help, the event system.
So with the ads, you're using the individual appointments ads for your low ticket, and then you're using the event ads for your higher ticket stuff, right?
Correct. That's how we're framing it. We're doing for higher ticket because obviously this packages for these devices and services, they're higher ticket. So we're using events to market that rather than offers or ads or whatever. So that way we can educate the patient first, be upfront with the pricing on what it entails so that we can have a better educated decision for them on committing on something that it's more expensive, because generally that's the case. They need more information and more proof, and that's one of the better ways to provide that is through the events.
I think that makes so much sense because everyone wants to bring in people for high ticket treatments. But the problem is
Mm,
that when you advertise for your IPL, for example, you're able to discount that heavily because that's an intro treatment, but you don't want to like discount your Morpheus by 75% to get someone in the door,
it's
right?
impossible.
And a lot of people are forced to do that because if you say come in for a free consultation for a Morpheus, that ad's not going to work. The free consult doesn't
Hmm.
work.
Yeah.
And it's hard to get a deposit for that since they're not really getting anything. And then those people
Hmm.
are going to no show. And then you have all these 1 hour or 30-minute appointment slots that you're losing. So I
Right.
think it makes so much sense. If you're going to run one on one appointments, you should do it for low ticket, a unicorn offer, have them pay some money and do a treatment. But then for your high ticket stuff, you do the events because if people no show, it's fine because you have a bunch of other people there. So much more
Exactly.
leveraged use of that time to sell your high ticket stuff.
Right. For sure. Is the good old one-to-many concept. And then once we started running those about 2 years ago, and then we tried the micro event of a smaller group, essentially is what I mean with when I say micro event. And then the next thing that I decided to do with Forever Books help is that we transition from doing an in-person into a virtual. So we're with the same framework, we adapted it to actually run virtual events. And I have to say that it became a small event of sorts, but we had a great traction on it. And then we're already having bookings as a result of that event. Obviously, over the next few weeks, we'll have more data as far as that goes.
Mhm. Yeah, no, I'm excited to build that out
Yeah.
more. Alright, so, need you to brag about Forever Booked a bit. What are your favorite parts
I
about
get
Forever
you.
Booked?
I mean, wow, what's not to like? I mean, they're pretty committed to helping us succeed. That's one thing. They are pretty accessible. We have great support. We have coaching. We have a robust platform in which we can advertise our practices and get great leads to actually then transition into being lifelong patients, essentially. Everybody in Forever Booked is they're all great. They all have great knowledge of what they're talking about, and it's just awesome. I'm not looking back, honestly. I'm not even considering to look to the to see if the grass is greener on the other side.
Mhm. That's awesome. Appreciate it. Well, what are you excited about moving forward?
Well, moving forward, I'm excited to all the things that you have prepared for us diligently. I know that there's a lot of things that are going to be incorporated in for us clients that Forever Booked has been evolving with. And I have seen all those evolutions. I can attest to that. I've been with you for what, 3, 4 years now, and we evolved, I would probably venture to say together. And I look forward to evolving furthermore. And as you guys have been evolving, we have been evolving as well and keep growing, which is one of the main goals that we have at this point. It's been a pleasure, great, and yeah, it's been a pleasure. And I look forward to furthering everything alongside.
Awesome. Thank you very much.
Thank you.